pandemic. I'm Min Sun-hee. Starting from today, we bring you updates every weekday on the situation in Korea in hopes of battling through these difficult times with our viewers here and elsewhere around the world with essential information about COVID-19 and heartening tales of courage and compassion aimed at containing this current contagion. Now, joining me in the studio today are No Aram and Kwon So-ah. Welcome.
Hi.
Great to be here in the studio with you guys. Of course, it's not great that we have to talk about this issue.
That's true. Okay, so I understand you'll be starting off with news from South Korea then.
Yes, I'm going to provide you with the latest updates here in the country. First off, I think it's a relieving news that we start off the new week with a much lower number of new cases than a week ago. Of course, this doesn't mean that we should be relieved as of yet, but if we do take a look at the numbers, the total number of confirmed cases stands at 8,961. So that's 64 additional cases we're seeing. And the total number of deaths stands at 111. That's 7 more cases. And meanwhile, 5,684 people are still quarantined and fully recovered people are at 3,166. So more than 250 people are now discharged as of 12 a.m. March 23rd. So we are seeing the lowest number of daily rise since late February. And last week we saw 2-digit rises and 3-digit rises. So it's still going up and down, but we do see a significant decrease. And if we take a closer look by region, we see 26 new cases in the southeastern city of Daegu, which is the worst hit region, and Daegu plus Gyeongsangbuk-do province. That's 24 in Daegu and 2 in Gyeongsangbuk-do province, and 14 new cases in Gyeonggi-do province, 6 in Seoul and 2 in Chungcheongbuk-do province, and 1 new case each in Busan, Sejong, and Gyeongsang-namdo province. So that shows how the number of patients in the southeastern part of the nation has significantly gone down. That's because the patients that stemmed from the so-called 31st patient from the Shincheonji religion, these patients, many of them have now recovered.
I see. So it's the sporadic cluster infections that we have to keep our eyes on then?
Exactly. And those we are seeing at hospitals and social welfare facilities and other places that are really vulnerable to the virus, like the call center in Seoul's Guro district as well. And that is why the government has called on 2 weeks of more efforts on social distancing. And that, along with the extended beginning of the new semester at schools that's slated for April 6th. So the new 2 weeks are seen as a critical time, and that's also been mentioned by Prime Minister Chung Se-kyun, who's on Saturday, in fact, called on religious, indoor sports, and entertainment facilities such as clubs to suspend their operations for 15 days. And the Prime Minister also warned with legal actions against religions that do not abide by government restrictions, and we did see that over the weekend on Sunday.
Right. So what's the situation like in Europe, other countries around the world?
Well, apart from these cases we're seeing here inside the country, the new concern is now the cases that are imported from abroad. The government has implemented strict measures at airports over the weekend. Around 15% out of the new cases stemmed from people entering the country. Since the first case in the country, since the first case that we saw here in the country, a total of 144 cases are related to cases from abroad, and which is why measures regarding entrance have been enforced. The latest move from the government is since yesterday, everyone entering from Europe needs to be tested for the virus, and if they do show symptoms, they are being quarantined.
Right. After much criticism for its stance to push ahead with the 2020 Tokyo Olympics amid the COVID-19 outbreak, the International Olympic Committee has now hinted at a postponement. We have Aram in the studio with that.
Yeah, so the IOC has given itself a 4-week deadline to consider its options, and while the IOC has emphatically ruled out cancelling the Summer Games, it will consider a scaled-down event or a postponement by a few months or even a year, which is seemingly the most likely outcome at the moment. It was only last week, actually, that the IOC President Thomas Bach said there was no plan B at all. The Games will go ahead as planned, but obviously the IOC has since softened its stance on that front amid a mounting criticism over its adamant that it's going to be pushing ahead with the Summer Games. Criticism from the public as well as athletes and Olympic governing bodies according to the country as well. And although the IOC has 1 month to examine several scenarios, the most likely option, as I said, would be delaying the Olympics to next year. So we could be seeing a Tokyo 2021. And it's not the only sports event that has delayed it by a year. The big football competition, the Euro 2020, is now Euro 2021 after being postponed by another year.
There have also been threats of countries not sending their athletes should the Olympics go ahead as scheduled, right?
Yeah, so this just came out moments ago. The IOC announced that Canada would not be sending its athletes to the Olympic or Paralympic Games if the Games are held this summer. So quite a threat there. Other nations such as Brazil and Norway have released statements calling on the IOC to postpone. Canada is the first nation to actually make a very strong threat against not sending athletes or a delegation to the Games if they go on as scheduled. Now, while the Canadians are better known for their prowess in the Winter Games, they still have a strong presence in the Summer Games as well. They came 10th in the medal standings at Rio in 2016 with 22 medals, and they did send 300 athletes. So they are quite prominent in the Summer Games as well. And shortly after Team Canada's statement, the Australian Olympic Committee released one of its own, telling the athletes to prepare for a possible Tokyo 2021 Games, indicating that it's unlikely Australian athletes would compete this summer, albeit it was a little bit less forthcoming than the threat from Canada.
It also seems that Japanese Prime Minister is starting to accept that the Olympics could be rescheduled then. Yeah,
so Shinzo Abe has publicly acknowledged that the possibility of postponing the Summer Games for the first time earlier today. A few government officials have before hinted at a possibility of rescheduling, but it's the first time for the Prime Minister to publicly announce the possibility. He said it may be inevitable, in his words, and until a final decision is reached, the Tokyo Games are scheduled to begin on July 24th, a little more than 4 months from now. So we'll have to keep our eyes on in the space of 4 weeks and see what the IOC decides.
Right. The outbreak has dealt a huge blow to businesses and workers alike. I understand the government is seeking to lend a helping hand. Tell us a bit more about this.
Yeah, so President Moon Jae-in and other high-ranking government officials have decided to return 30% of their salary for the next 4 months. The decision came after an emergency meeting presided over by Prime Minister Chung Se-kyun over the weekend. Now, these government officials, their salary will be returned to the state coffers, and the Finance Ministry will use the money for quarantine efforts and support people financially hit by the pandemic. The President, the Prime Minister, as well as Minister and Vice Minister level officials will join the move, but other high-level civil servants might follow suit as well. The returned pay per individual is expected to be somewhere between $10,000 and $20,000 US dollars.
What's the public response like to that?
Well, obviously the public response has been somewhat positive so far. Online comments mostly are comprised of praise and how they're saying it's desirable for ranking officials to share the burden during these difficult times. The move has also, however, moved the crosshairs to some lawmakers. So people from the National Assembly, many have been calling on them to do the same, or at least levy some of their salary, a portion of their salary, to the fight against the coronavirus outbreak. And they have been criticized for not doing enough, not enough practical measures, and they have been under fire for wasting taxpayers' money as well. And some Democratic Party members have actually followed suit.
Right. Now, up next, we take you to the daily briefing by the Central Disaster and Safety Countermeasures Headquarters on the latest tally of the COVID-19 here in Korea. But before we go there, we'll take a quick look at the numbers that we were given earlier in the morning. As of early Monday, we have 64 new cases of the virus, raising the total tally to 8,961. We'll see whether that number is the same in about a minute when we have the briefing by the Central Disaster and Safety Countermeasures Headquarters. Right, in fact, on our screen right now, we have those numbers that Soa gave to us earlier. We have 8,961 cases right now. We have 111 deaths. And for recovered, we have a total of 3,166. Elsewhere around the world, we still have China taking the lead at more than 81,000 confirmed cases. Italy standing at second with 59,000 confirmed cases. Iran 21,000 and Spain more than 28,000.
Let us now begin our regular briefing for March 23rd, Monday, on the coronavirus outbreak here in South Korea. As of today midnight, there are a total of 8,961 confirmed cases. Of them, 144 were imported cases from abroad, and of them, 3,166 have been discharged following full recovery. And the total number of new confirmed cases was 64 from yesterday. And we also saw a total of 5,684 who are in quarantine, down 200 from the day before. We have witnessed that about 81% were related to cluster infections, and the rest were related to sporadic cases, which amounted to about 19.9%. And in Seoul, there were 6 newly confirmed cases centering around the Gurogu call center in Seoul, and there were also an increase in the imported cases here in Seoul. And in Daegu region saw 24 more confirmed cases, and they were the contacts and the families of the Shincheonji confirmed members. And we witnessed a high increase of these numbers, and also witnessed an increase of the patients surrounding the nursing hospitals. And in Gyeonggi-do province, we saw 14 new cases. They were related to the River of Glory Church, as well as Gumpo Hyosarang Nursing Hospital. And yesterday, among the imported cases, we have identified 13 at the airport quarantine. And overall, we are seeing about 44% related to Shincheonji and 81.8% related to cluster infection. And let me go into the details. In Seoul City Gurogu call center, we are seeing more people of 4 cases additionally from yesterday. And starting from the 8th of March, we have witnessed 156 confirmed cases. They were mostly, about 93 of them were the work people who are working on the 11th floor. So we are seeing the infection rate of about 40% at the Gurogu call center. And in Gyeonggi-do province, we are witnessing cluster infections. 4 more identified cases at the River of Glory Church, making the total to 70 related to this church. And 3 of them have been tested positive while they were put on self-quarantine. And we have witnessed 1 separate case. And on this case, we are doing and conducting the contact tracing right now. And in Daegu, we have completed the enumeration investigation on the high-risk fatalities. And we identified 4 new cases from the nursing hospitals in Daegu. Starting from the 22nd of March, the CDCH has made it mandatory for all inbound traffic from Europe to have a screening test for coronavirus. And yesterday, we had about 1,400 inbound traffic from Europe, and about 150% of them, or 150 were conducted of the tests at the airport, and some of them had direct flights from Europe, and also we saw layover flights through other places, including Dubai. And of all of the inbound traffic from Europe, 92% were Korean nationals, and about 12,000 of these people flying in from Europe have been all admitted to the temporary accommodation facilities, and so far we have the test results for 6 people, while the rest we are still waiting for the results to be analyzed and to be released. And if they are tested negative, they will be sent back home, and they would be also monitored through the active monitoring system by the health authorities. And if they have symptoms, they will be moved to designated hospitals as well as live treatment centers. And of the 64 new cases that we saw yesterday, about 15% were related to inbound imported cases. So we ask you to participate in your canceling of your travel abroad schedules if it's not necessary. And if you are returning back from abroad, please report your travel histories to our quarantine officials, and please go through our necessary quarantine measures. And after coming back to Korea, please stay at home for about 14 days and refrain from social from outdoor activities. And all of those who are returning from Europe, I ask you to comply with the government quarantine measures. And for companies and businesses, if you have employees who went on business trips abroad, please let them stay home for the next 2 weeks. And we are witnessing a global outbreak of the coronavirus. And still here in Korea, we are continuing with cluster infections. So from the 22nd of March, we are intensifying our social distancing measures for the next 14 days. And we are asking all of the public to refrain from going outdoors, aside from essential travel to the grocery stores or to commute to work. And even at working places, please wash your hands thoroughly with soap and water and keep with the coughing etiquette. And for business owners and the employers, that is, we ask all of you to minimize the contacts among the employees so that they could keep a certain distance while they were working at the office. And if you have employees who have symptoms of fever or other respiratory symptoms, please refrain, make them stay at home. And if they have other symptoms, severe symptoms, please let them stay at home as well. And the government also is restricting the businesses of operations of major social facilities, including sports and other entertainment clubs. And we are also seeing an infodemic, which is a spread of fake news regarding coronavirus, which is becoming a big threat against the public. So any rumors that can spread through SNS or online media, we hope you can identify whether this information is verifiable. And one of the most responsible case of infodemics is the case that we saw at a church at Gyeonggi-do province by spraying salt water into the mouths of the worshippers there. And there were also spraying of methanol, which is used for commercial use of the alcohol, has been caused great detrimental to some health conditions. So please check and verify the source of the information. If you have come across any suspicious information, please check for yourself whether this is verifiable and whether its source is verifiable. And please call us the call centers to check whether these information are true. And very recently, we have a survey, a questionnaire that has been conducted by a special institution here in South Korea, an online institution here in Korea. It stated that by relying too much on the coronavirus information, it can lead to severe detrimental health harms on the public. So it also highlighted the importance of verifying the source of information and evaluating for yourself whether this is true or not. And the KCDC will intensify our social distancing measures up until the 9th of April, and we have switched our briefing to online briefing, and today's briefing as well is carrying out at online, and we will receive questions from the press who are joining us online. Thank you very much.
Right, and that was the latest government briefing on the COVID-19 situation here in Korea. Just a small summary of that, a short summary of that. There have been 64 new cases as of this Monday, bringing the total to 8,961 as of Monday afternoon. This is the lowest daily increase in a month in Korea since its peak of 909 cases on the 29th of February. Meanwhile, 7 people have passed away, raising the total to 111. Thus far, slightly more than 3,300 that is, and 38,000 people have been tested for the virus here in Korea. Over in the U.S., there have been more than 33,000 confirmed cases of COVID-19 there. For more details on the grim situation in the U.S., we have Jerome Kim, a resident of Los Angeles, on the line. Hello, Young.
Hi, how are you? Good afternoon over there. Right now, it's a little over 10 p.m. here in Southern California.
Right, Young, what's the latest that you have for us from there in L.A.?
Okay. First of all, I'm pretty sure you've heard about the shelter-in-place order that was placed about 5 days ago. Last week, LA Mayor Eric Garcetti made an announcement calling for the closure of restaurants and other entertainment venues in the city of Los Angeles. Then the next day, Los Angeles County adopted the policy. Then on the 17th, California State Governor Gavin Newsom announced a shelter-in-place mandate for every Californian, with only essential businesses to remain open. Now, these include supermarkets, convenience stores, gas stations, and restaurants for takeout orders only. Now, people are allowed to go out for essential needs and are being advised to stay at least 6 feet or roughly about 2 meters away from many.
Young, there was a slight technical problem right there. Do we still have Young on the line, though? Right, I'm afraid we have a slight problem there. We'll get back to Young if we can later on in the program. Meanwhile, COVID-19 has gained notoriety not only for being highly infectious, but also for having no cure, no vaccine. In fact, the big question across the globe now is when will such treatments or vaccine, that is, be ready? For more on that question and others, we have in the studio Dr. Jerome Kim, Director General of the International Vaccine Institute, and Jason Strother, a journalist for the World at Public Radio International. Welcome to the studio.
Thank you. Nice to be here.
Right, Dr. Kim, the World Health Organization has declared the COVID-19 pandemic. How would you describe the situation being faced by the global community right now?
I think that this is the most serious threat that the global community has faced from a pandemic perspective since the Spanish flu epidemic of 1918 to 1919. I mean, when you're looking at the impact on the economy, the number of lives lost, the potential for spread through many regions of the world, I think the public health authorities are doing what they can. I mean, all the shelter in place, the social distancing, all these are temporizing measures. They are designed to spread the disease out over a bit more time so that the medical system can cope with the number of patients and the people who need respirators or medical care. And at the same time, we have to remember that the healthcare providers who aren't being protected in many parts of the world because there aren't adequate gloves or masks are also at tremendous risk, and this further impairs our ability to respond to the crisis.
Jason, the situation in the US is worsening by the day. The number of cases there has topped 30,000. How is the US media covering this story?
Well, it really depends on what media you're talking about in the U.S. I mean, we've seen surveys coming out from Pew saying that Americans who identify as, let's say, Democrats and watch media that is considered liberal or progressive take the pandemic very seriously, whereas Americans who identify as Republican watch media that is considered to be conservative, they appear to be much less concerned. And this could have a lot to do with, for the first couple months, since China first warned the rest of the world about COVID-19, conservative media in the U.S. have been playing down its severity. And whereas, let's say, more mainstream media in the U.S. had been kind of issuing sometimes hyperbolic warnings about the disease. So that has had an effect on kind of American perceptions of the virus.
As one news media outlet, in the US put it, the US went from being a distant spectator of the pandemic to one of its primary victims, highlighting once again the importance of early prevention and quarantine intervention, with the government here in Korea, of course, garnering quite a lot of praise for its actions, quick response that is to COVID-19. What is the public response to the Trump administration's handling of the situation?
Well, there were many mixed signals coming out from the White House. Initially, you had President Trump saying that this was essentially a hoax to hurt the stock market, hurt his re-election chances, something that was cooked up by the Democrats, the liberals, as well as liberal media. He said that this was not anything to be too concerned about. The president has come around recently and has been following the advice of the experts at the Centers for Disease Control in the U.S. So again, it comes down to political biases in the U.S., and it doesn't help that 2020 is the presidential election year. So again, you have people who identify as conservatives feeling, that the president is doing a bang-up job at handling COVID-19, whereas people on the left, the Democrats, are much more skeptical of the president's approach.
There are also concerns over the possibility that the virus could mutate. Now, this follows news of the death of a Korean teenager here who showed signs of pneumonia despite testing negative for the virus itself. What, Dr. Kim, could you tell us about the possibilities of mutation?
So first, with regard to that young boy, unfortunately, there are other causes of viral pneumonia, several of which are lethal. And the official final test from the KCDC was negative. But assuming that and we know that there are mutations that occur in coronaviruses, they don't occur quite as frequently as some of the other viruses like HIV or flu. So although there could be changes, it's not clear yet. We don't know enough about the virus, but based on other coronaviruses, it may not be that different next year if it's still around.
I see. According to Chinese researchers, there is an experimental antiviral drug. It was initially made to treat the Ebola virus, and it's been found to be effective in treating severely ill COVID-19 patients. With clinical tests, of course, underway here in South Korea as well, what options does the world have so far in terms of treatment methods?
So the primary treatment at this point is supportive. We give people fluids and oxygen. We treat pneumonias if they develop we treat bacterial pneumonias if they develop with antibiotics. But really the only sure treatment that we have is to support people through the illness and as they get better. Remdesivir is an antiviral made by a company named Gilead, and it has activity against COVID-19, and that's actually a great thing. But I think we have to remember, we went forward with treatment with an anti-HIV drug called Kaletra. The data don't look as promising, and it's important to realize that if you have 100 people who come down with the infection, 98%, so 98 out of 100 will get better on their own. So when we give someone a drug, it has to shorten the duration of infection, maybe the duration of shedding of the virus. It should prevent transition to severe pneumonia, or importantly, prevent people from going on a ventilator, and hopefully shorten their hospital stays so that there are more medical facilities available for subsequent people who get infected. So I think Dr. Fauci has been very adamant, whether it's hydroxychloroquine or remdesivir, we have to do these trials to understand what really works. Because in a situation which we often don't find ourselves in, for instance, in the United States, where medical resources may be limiting, we really have to use everything that we have that's the best of what we have to offer and that we know works. And we have to avoid things that have an internet presence but have no real scientific or medical data to back them up.
And that is, of course, what the Central Disaster and Safety Countermeasures Headquarters announced during their briefing as well. Jason, I understand the US is now using the world's fastest supercomputer to perform simulations on drug compounds. Could you tell us a bit more about that?
Right. Well, this is something that really differentiates the way governments have been able to address epidemics and pandemics, compared to, let's say, the SARS outbreak in 2002-03, when we just didn't have this type of technology. The U.S. is working with IBM with their supercomputer called Summit, which is able to, analyze thousands of drug compounds to see which would be most effective of being able to detach the coronavirus from cells. Now, I don't want to get too in the weeds about molecular biology here, but this is at least a promising advancement that could, replace, if humans were doing this, it would take many, many weeks, months. This really makes the process much more rapid and could hopefully lead to either developing a vaccine ideally, but if not, just improving treatment against the disease.
Right, Jason. We have our young Kim back online in Los Angeles, and I understand we can actually talk to him at this moment. Young, hello again.
Hi, I hope it's on a better connection. Welcome to broadband in Southern California.
Right. Young, you were talking about the situation, the stay-at-home order there in the
That's right.
in LA. Could you start from there again?
Okay, I will let you know. It is a shelter-in-place order that was put forth by California State Governor Gavin Newsom, and only essential businesses are remaining open: supermarkets, convenience stores, gas stations, and restaurants for takeout orders only. People can go out for essential stuff and are being advised to stay at least 6 feet. They call that the social distance right now, roughly 2 meters away from each other, with many businesses not allowing over 10 people inside the establishment at one time.
Young, what about religious gatherings? I mean, here in Korea, Shincheonji fueled a shocking surge in the number of confirmed cases.
Okay, you're absolutely right. I mean, I did mention that this is a shelter-in-place thing, and all religious institutions are not supposed to gather for services of any kind. And right now, as far as I can see, we don't see a lot of that happening right now. So that kind of stuff we don't really see, but people are actually going to social media, or, for example, doing like a conference service, or through Kakao Talk. They're sending Bible verses and Bible study notes and stuff like that through Kakao Talk and other means. And even like gyms and CrossFit, yoga, they're doing a lot of their things online now. They're using the broadband, and they're using different methods to reach out to and stay in business actually during this time. So we don't see a lot of religious, there's no Shincheonjis here so far, that's for sure.
I see. I hope it stays that way. Now, what's happening in California is especially concerning for us here in Korea, as many Koreans are actually there seeking to make a living. How are they faring?
Okay, well, I'm one of those guys. I own a small business myself, and right now we're closed. We're only doing takeout orders for now. And many Korean businesses are doing the same thing. I actually went to buy some tteokbokki the other day, and we had to wait about 30 to 40 minutes just to get 2 orders of tteokbokki. So some of these businesses are doing well. Others, such as Korean barbecue restaurants, they probably aren't doing so well because of the fact that they're supposed to have cooked food basically cooked right in front of you, right? So all bars, restaurants, and entertainment establishments are closed. I mean, Disneyland's been closed until further notice. Movie releases have been going online. Films either delay their release or they're going ahead with a digital VOD release. Food and beverage businesses have been closed. This includes norebangs, bars, clubs, and whatnot. But food businesses, as I mentioned, has been classified as essential business only for takeout. So some of these things are going on. Now, many businesses are coming up with these ideas to stay afloat during this entire ordeal. But, right now, I think people are seeing up to 90% down revenues. So it's not a good situation right now. But of course, there are certain stimulus packages. Well, one that they were supposed to try to come to an agreement earlier today but that fell apart. So people are waiting for some kind of news of some kind of financial support and some kind of stimulus.
Which means bigger businesses are bound to bear, brutal brunt of the situation then, right, Young?
Yeah, right now they are, but they're talking about, like, for example, delaying your taxes or, delaying certain payments without penalties. So they're trying to come up with some kind of ideas. But I just wanted to mention that Korea has kind of been at the forefront of all this. In the beginning, we were watching the situation and having doubts on how it was being handled correctly. But everything that Korea has done so far has sort of become a model when we're talking about, like, the drive-through testing centers. And a lot of things that our nation is doing has become sort of a benchmarking type of model for other countries.
Right, okay, that was Young Kim with us live from LA. Thank you, Young. We hope to see you again soon.
All right.
Right, back here in the studio, we have experts joining us for talks on COVID-19. We have Dr. Jerome Kim and Jason Strother. There was a slight interruption going back to Young Kim in LA. There are also many different outlooks and opinions regarding when we might see a vaccine for COVID-19. Dr. Kim, what are your thoughts on this?
So under ordinary circumstances, if someone were to ask me how long it takes to develop a vaccine, I usually say 5 to 10 years. But these aren't ordinary circumstances. So governments around the world and regulatory agencies have gone through extraordinary lengths to try to accelerate the process of vaccine development. But a lot of things aren't known. Dr. Fauci thinks that maybe in 12 to 18 months we'll have proof that a vaccine works, which would be remarkable considering the usual 5 to 10 year time frame. But the things that are big questions are going to, haunt us. Or are going to be things that scientists and ethicists and medical doctors will question. The first is, we don't actually really know that a person can't be reinfected. So, for instance, if you had the measles, you'd be protected against the measles for the rest of your life. And in a way, the vaccine does that. The measles vaccine protects you against measles. But we don't know that's the case for COVID. We think it might be the case, but so far all that information is based on 2 monkeys in China. So we'd like to get more information that infection protects against reinfection. And that's important because if we can do that, if infection prevents reinfection, then a vaccine is possible. It's the easiest, the surest idea that the vaccine may be possible. The second part of this is that we don't know how long, if there is protection, how long that protection will last. And the durability of protection is actually very important if this epidemic is going to go on for some period of time. The third part is we have a suspicion that in order to protect a person, they have to have infection-fighting proteins called antibodies and also killer cells that will target and eliminate the virus. That's a good hypothesis, and it's one that usually works, and we're hoping and we're banking on it, but we don't know that for sure, and we don't know which ones specifically protect. The other part is, typically, and this has now been shown, at least we have preliminary data from some of the companies, that the new vaccines that they're testing may protect animals against infection. That's actually an important proof of concept, and we're hoping to see some of the data published. And people have been really outstanding at providing information as it's being developed so that people around the world, scientists around the world, can benefit from that. And the final part of this is, we give vaccines to people who are well. And so the last thing we want is for a vaccine not to be safe. And there are going to always be safety questions, particularly as we accelerate the testing. So we always in the back of our mind have to absolutely make sure that the vaccines that are being tested in humans, vaccines that are going forward into implementation, are absolutely safe and protect.
Right. And speaking of vaccines, Jason, the US has started its first clinical trials for the COVID-19 vaccine. Tell us a bit more about that.
Right, well, first, I don't know if Dr. Kim is making me feel more relieved and more concerned with what he's telling me. But,
me neither.
Wow. But right, as he said, safety is a top concern. And I think this, all bets are off the table during COVID-19 in many respects. So Kaiser Permanente, a pharmaceutical firm, has begun human trials in the US, in the Seattle region, I believe. Only with some 45 people so far who have volunteered to try out this experimental vaccine. Normally this could take many years for a vaccine to be approved by the Food and Drug Administration, the FDA. But now there's some reporting out there saying that it could be somewhere in the ballpark of 18 months. Seems pretty quick, but the people who are participating in this human trial, it's going to go on for at least a year. They have almost monthly check-ins to see if they've been developing any side effects or other reactions to the experimental vaccine. So we will just have to wait and see how that progresses.
Dr. Kim, do you also share the view that we'll have to wait at least 18 months to see a vaccine?
So 12 to 18 months, we may be able to see evidence that it works, that it generates the correct protective responses, and maybe some evidence that it protects humans in the next 12 to 18 months. Getting a vaccine, if you think about the announcement in the middle of January, I mean, to have vaccines being tested in humans by the middle of March is really actually remarkable. And safety is a very, very important concern. But as the death toll mounts in Europe and in other places around the world, it's going to be harder and harder to keep people from rushing and trying to get ahead of us. But we really need to show, in the same way that we need to show that drugs work, we actually have to prove that a vaccine protects against infection.
And staying with that, Jason, I understand that the US and countries in Europe are seeking to save time by allowing trial stages to overlap with one another.
Save time, that might be a generous way of putting it. I think we should be more concerned about a sort of arms race happening with developing a vaccine. The COVID-19 pandemic has not brought out the best in the global community. Borders are being closed, or other sorts of restrictive measures are being put in place. Why should a country that is the first to develop a vaccine spread it around the world when they have a domestic need to take care of first? So I think right now, for better or worse, every country is, I think the World Health Organization says there are around 20 or so different trials being undertaken right now to come up with a vaccine. Every country might feel that this is sort of a Lord of the Flies situation, every country for itself. So if the US develops a vaccine first, they're going to give it to their population first. If Germany does, if South Korea does, it's all going to be consumed domestically first before they start spreading it around the world.
Dr. Kim, is it true that we don't have a vaccine for SARS and MERS, right?
We don't. But if I could just elaborate a little bit on the previous question, there is one kind of ray of hope here. Maybe if you're China or the United States, you're big enough and wealthy enough to push a vaccine forward on your own. Maybe you have the right technical skill set. But for the rest of the countries around the world, to do this in a coordinated fashion, to go through all the steps and all the testing and having to do it in other countries, there really is a need for us to work together. And so there's an organization called the Coalition for Epidemic Preparedness Innovations. Countries around the world have put $1 billion, actually now they've pledged additional hundreds of millions of dollars to work together to come out for a solution for epidemic diseases. And of course, COVID-19 is the epidemic disease of concern. So really immediately after the announcement in mid-January, CEPI put out a call for who can make a vaccine quickly. Can you do it in 4 months or less into humans? And they got replies and made contracts very, very quickly. And the first of those companies actually injected someone on the 17th of March. And other companies are going to be bringing vaccines online in April. It did bring out some bad behavior. I mean, a supposed attempt to purchase the German version of a company. But I think the members of CEPI are really committed to doing this together because they realize that a virus that has no borders really threatens everybody. So there may be some hope.
Right.
Let's hope.
Yeah, that's a big hope.
What, Dr. Kim, are your words of advice to Korea regarding its efforts to battle the coronavirus?
So I think Korea has done remarkably well. They've won the first phase of the battle. But it is a war, not only a battle. And the price of success is actually vigilance, eternal vigilance, until the COVID epidemic disappears from around the world. So right now, Korea should prepare for the next round, which I think it's doing. Take some of the lessons that it may have learned about how to make the process more efficient, or how to do the screening at the airport more efficiently, or but then share its knowledge. I mean, I can't tell you the number of groups around the world that are calling and saying, so what did Korea do right? And how can we change things in our country for the better? And where do we get those kits from? Because we need more testing kits. And did the KCDC, the Ministry of Food and Drug Safety, review those well? And what are the data? This is evidence that the Korean approach worked, and it's going to be a little difficult to implement everywhere because not everyone has access to the kits, or to masks, or to personal protective equipment. So there's a lot more work to do, but as long as that virus exists somewhere, it only takes one person to fly back to Korea, and the whole thing will start again. So the government has to be on its guard.
Right. Like Dr. Kim just said, Jason, we have won the first phase of the war. What lessons do you suppose the US could take from South Korea in dealing with the COVID-19?
There are many lessons. I think even you have political leaders such as the governor of Colorado saying that the US, or at least the state of Colorado, needs to follow the South Korean model. I'm not sure how much of that can be replicated in the US, not only because in terms of scale, we're talking about a country with somewhere around 6 times the size of the population as South Korea, but there is, there's something in America, a distrust of experts, a sort of libertarian view where Americans don't want to be told to stay indoors or shelter in or stop going to public parks when their elected officials tell them to avoid transmitting the disease, it requires. I think Americans need to follow the mode of the South Korean people and respect the experts. And if the CDC or whatever health experts say is the right way to go about preventing the disease, I think Americans need to listen. And I think South Koreans have done a very good job at doing that, and is perhaps a reason why we've seen numbers stabilize here.
Right, Jason Strother from the Public Radio International and Dr. Jerome Kim of the International Vaccine Institute. Thank you for your time today.
Thank you.
Thank you.
Right, that brings us to the end of today's special coverage of the COVID-19 pandemic. We'll be back tomorrow at the same hour with more updates and stories, so be sure to join us then. Now, in the meantime, be sure you can send us your inquiries about the coronavirus situation and maybe share your thoughts with us about the global pandemic on our website, arirang.com, or follow us on our social media accounts down below. Thank you for watching.